Hello. Hi. Hello. I'm Dr. Maria Sulindro. Uh, how are you? I would not say good morning, good evening, but today is 5 o'clock, Thursday, and every Thursday, 5 o'clock, Pasadena, California, I go live with healthy aging or anti-aging information. Okay, now today the topic is about well, today's topic is about diet. Okay, and let me see, how do I go here? Oh, guys, I am a little bit rush here because I couldn't even open my gate outside to let someone in. So let me see, how do I go from here to there? Just a second, okay? Bear with me. I'm not a high-tech person, but oh gosh. Okay, so I think I'm going here. Well, it's okay. Now, to prepare this one, I'm lacking one list of the books that I refer to. There are 15 of them here, okay? And then I will just put it in the box, comment box after it get posted, all right? How are you doing? Now, diet is a very specific. I think it's everyone has their own diet. What diet is something you eat. So during the pandemic lockdown, I think it improves our quality of life in diet because home cooking is always healthier if you know the knowledge. So I'm going to just share you what I know, okay, and what I do here. And I think during the pandemic, our cooking at home is more nutritious rather than those fast food or people who sell the food to us because they use some of the bad oils that we don't want to put it in our body. It is difficult to go out here because of the lockdown, but now I'm not sure in your area, but now people are start coming out again. So we'll see what happens. But some of my patients have already complained that they have gained unnecessarily weight and also not in the area where they wanted to gain, okay? When we have to know about a better diet, I want to share with you that I have been blessed to see the difference between delicious food and good food or good diet. I don't have a cookbook that I wrote because I'm not a measured cook where you use those spoons or cups to cook, but I will just use, pinch of salt. But I'm going to give you some tips that I know and what I think is healthy for your body and does not make you age faster than you should. When you should, one moment. When we should eat healthy, well, I think since you can put anything in your mouth, so obviously this is since you were born. So you have to train your children young enough, starting when they're young, and to have this knowledge, because when they grow up, then we depend on their wisdom whether they want to kick in this knowledge and practice it, or to follow the advertisement and the commercial of the bad food. This is very important. For example, okay, you're accustomed to a certain taste, like sweet, salty, spicy, tangy. I like spicy, hot, spicy. But your taste bud connects to your brain. And we do have what we call craving sensation that drives us crazy. Like I have to have this, okay, this taste. This is the problem because you grew up to develop one taste habit more than the others. However, since food is cultural, so like I said, I'm blessed that I can at least differentiate the difference between good tasting bad food, and good tasting healthy food. That is very important. So now, like I said, wisdom just now, that's because usually many people, they know what is bad food, what is bad drinks, but they are not willing to change because they're not wise enough, and they are not going to exercise their knowledge to practicality. Today, let's just ignore that wisdom definition and stick with the healthy terminology. For example, I give you a good example is breastfeeding or formula. This is very good example because it started from the beginning. People who can breastfeed will more likely to have children who grow up with good satiety to good food, as mother's milk is the best formula with tons of growth factors and also immunoglobulin. Baby's formula is processed. The children will have to use a lot of their knowledge and training to be accustomed to good healthy food before their body can adjust what they're used to be. Therefore, the formula they take from babies has tons of refined sugars and is not very healthy. Okay, unfortunately. But some mothers with their health conditions, they cannot breastfeed. So babies have to do, we have to do something. So we have to give babies formula. So it's not like they're not wise, but after their postpartum or delivery, some mothers, their body changed, and some of them, they go into depression and things like that. So the milk doesn't, it was not ready. So the food at home, how about the food at home? I never grew up with the knowledge of healthy food. My parents did not say, oh, this is healthy, this is not. It's just by instinct. As a Chinese Asian, I'm third generation born in Indonesia. I know what is good, but only tastes good. And food with lots of stories, okay? And high prices, low prices, such as shark fin soups, abalone, lobsters with extra spicy sauce. Indonesian has good salad called gado-gado. It has peanut sauce that I don't think is healthy unless you make it yourself. But still, peanut is very allergenic, right? And it's very sweet. And they have sweet dessert with sugar, mixed fruits, shaved ice, and it has gluten and starchy, delicious taste. Now, those, I grew up with that. Then I went overseas in very early age. Like I was 14 when I went to Singapore for my high school. And the city was full of good, excellent street foods. Unlimited time, 24 hours, you can still find good food outside. Good food, good taste. Okay, I select my own food since very young, and with the same base, taste and price, same base, same knowledge. Then I went to college or university. I learned to drink coffee, to stay awake and study hard in my medical school, not knowing that I have a problem with coffee and tea, basically caffeine. I have a broken genes. I have a broken gene for magnesium, but I just found out about that. About the coffee, I found out like maybe 40 years ago, 35 years ago. That actually changed my course direction of, in serving in as a medical doctor. I would like to use this opportunity to talk a little bit about this coffee. This is a lifestyle that is spreading in the whole world. I drink initially was 1 cup a day during our group study in the evening. My parents noticed that when my friends came to our house, I will then found to rest in a guest house, falling asleep. So this is the complication. I had gone to a hypomagnesia stage because coffee and tea, the caffeine actually suck the magnesium out from our body. And then I was found worse as I could not pass my morning routine and was occasionally found on the floor, passing out. Short story, I survived studying, but I had to take medication, heart medication to stay awake, not knowing that those orange pills were amphetamine. So I met Dr. Abraham Gee, my lifesaver actually. He has passed away a few years ago, maybe like, I don't know, 5 years ago, who became my close mentor in searching for a problem for me. He found that my biological age then was 74 and my physical age then was 27. I did not look 74. I was shocked then because I thought, oh, maybe I will have a stroke or heart attack and I die young, okay? So, but he convinced me that coffee was my problem after all the interviews. He told me that this coffee had made my magnesium is so low that I have cramping, I have a problem with my hormone, and I have a thinning hair, I have polycystic ovarian disease, I lost my first baby actually, and had early osteopenia stage. That's a lacking of bone in your bone, right? And then it will become osteoporosis if I'm not careful. So the great coffee has a potential to take your magnesium, which is the most important mineral in our body. This is why for many years, medical doctors have advised you just take calcium daily and eat nice, okay? And what happened? The number one bone disease in the whole world is still one, osteoporosis, because coffee has become a lifestyle in our diet. What else? Yes, calcium. Then they tell you to take calcium. You take calcium without the transportation, which is the magnesium, right? You just take calcium and vitamin D. There's a calcium with D, right? So what happened? That's the culprit. Because the heart disease, number one leading cause of death is heart disease. What is that from? From the calcification in your artery. So what did I do? I changed my lifestyle, right? How and what do you think we need to do? This is not for us to move away from our place or change the job or get more income. This is just to slowly change the bad one so that we can live happily and healthy. We already eat what we usually eat and drink, right? So you need to understand what is it in your food to change. For example, I changed. I stopped drinking coffee right away. I haven't drink coffee or tea since that was 35 years ago. And I only drink water. I know which water is good, which water is bad. I'm a water person, okay? Just plain water. Or the way we use spice, for example, salt. Don't use a processed salt. Just use sea salt or Himalayan salt. Or avoid candies, but just eat fruits that has good sugar instead for your sugar. And get an organic fruits and vegetable if you can afford it. We only have one body and we need to be in charge of our own health. Why do we have to follow the new food that has been reconstructed by industry? They want our money by adding sugar and other coloring or preservative or spice that are not supposed to be in our body because it create a problem. Our body is very strong though, actually, yeah, but it has its limit. And if you eat or have a diet that is rich in vegetable, more grains, low in saturated fats or processed food, okay? I mean, avoid this processed food and use good oils, good protein. Use low glycemic index, so which is a low sugar content of fruits to nourish your body. Then you will grow healthier. Okay, so let's talk about food in terms of, diet is food in terms of how it goes in and goes out, right? Digestion, you need the digestive enzyme. We have thousands of enzymes. We have discovered a few only. So it's called digestive enzyme, one of them that is available in your food and also as a supplements if need be. You can get it from the rich of enzyme and take them prior to your meal. Let's say 15 minutes before you eat. You eat papaya that has an excellent enzyme called papain, or apples, malic acid, pineapples, but um, more more organic. Okay, do not eat it from the can or processed, because this is a better enzyme. Of course, the canned fruits is very bad. We have our own enzyme, right, for digestion. As we need to masticate, so we need to choose something so that our gastric acid will come out and help to digest our food. That's the reason why you have to eat your fruits before your meal. So after you eat your food, what to do? What does that means? Okay, it goes to the small intestine, and then you get your nutrition absorbed from there, very little. And your stomach is this big. So when you eat, so you don't stretch your stomach too big, okay? You need this much of food, only. So healthy colon, and then what happened after it goes from your mouth to your esophagus, and then it goes to your stomach, okay, gaster, and then it goes to ileum and jejunum, which is the small intestine, very long. That's process of absorption of the nutrients if you have nutritious food. Then it goes to the colon. So if you eat this much, you have to see your bowel movement move this much of waste products, because in the colon, after 2 to 3 hours after eating, you should have, if you have good gastrocolonic reflex that works, you should have the urge to go and move your bowel. Now, some people still have that one for some reason. They're very blessed, okay? So what happened? Some of these people, they were trained to, they have this gastrocolonic, and they feel like they have to go, but they're in the meeting. So they said, not now, I'm in the meeting, not, well, later. Okay, they can, the brain, this is brain number 1, the colon is brain number 2. So what happened is that urge to go disappeared. And then pretty soon that gastrocolonic reflex, if you tell them, not now, then they will say, okay, I won't notify you anymore. Then you won't have that feeling or urge to go after your meal. So many people lost this, and then they become constipated. Constipation, a definition is not only that you cannot go because it's hard. No, constipation means you eat 3 meals and you go only 1. And normally this 1 and only is in the morning, because at night is when we detox. So then that has to go out. And in the morning, after you drink something, hopefully water, then you go to the bathroom and you move your bowel. But that's not the normal after meal eating. When you have a baby, each time you feed them formula, the baby soil the diapers. So that is the original gastrocolonic reflex works. So that's when you can detox, those waste products come out because all the nutrition has already got absorbed. Then then you develop healthy body. If you need helps, then you take probiotic, you take flaxseed, you take kefir, and you just decrease your gluten intake and wheat products, then it might help you. In our office, we have hydrocolonic system, the open system, and a patient who has not gained back, because we are telling them that we are training them to gain back this gastrocolonic reflex. They come here, they enjoy these 12 to 15 gallons of sterile water, it's actually treated water by ultraviolets, and then they'll go and clean their colon. They feel so good. Believe me, you will feel good if your colon is empty or clean. Children eating with running around, standing, walking, and someone will feed them and follow around. Those are not a good position because your body needs to relax when you eat. Especially when those people who watch TV, make sure you do not turn on those bad news or very scary movies in front of you, and cell phone is off, bad news, just focus eating. So the ambient and environment is very important. That's why sometimes you feel that the restaurant's food is better, because they use this technique to create the ambient for their customers. Food rotations. Okay, what about food rotation? In my office, when we test the patients with their diet, we use the immunology Genova testing, and they give a list of the immunoglobulin food that they should avoid it, and then they give us the list of rotation, meaning that you don't eat the same food every day. So you rotate it every like 2 weeks or 4 weeks, and it keeps changing vegetable and also the food that create inflammation in your body. We keep changing now. That's a better way to eat. Raw vegetable and organic is probably the best. Okay, this is to allow our body an easier digestion of food and not contaminated, because pesticide, herbicide, insecticide, those are going to damage the food that we eat or vegetable. Also, if it's pasteurized or heat in a certain temperature, you have no more vitamins. The other day someone asked me how to look for an extra virgin olive oil, the good one. Well, you look at the label, and then it will say organic. It will say cold pressed for olive oil, because it is not heat resistant. And then extra virgin. But then don't forget, you have to look for unrefined. Okay, I use certain brand, like Patricia Bragg's has this Bragg's spices everywhere, and I use their brand, and hopefully they are the best. I don't work for her. Okay, when you buy food in the market and also selecting your spices, you want to select one that does not have trans fat, pasteurization, homogenized, bleach, deodorized, partially hydrogenated, and refined. Those just, they have label like that, then don't touch it. How about cooking oils? Asian, we use oil and fat. Okay, you can use ghee. Ghee is the pure fat without the solid milk, right? Of course, it is better than butter, but you can see in the Mediterranean diet and Indian food, they usually have this, the ghee, and you can use it on their basmati rice. It's delicious. You can use butter, unpasteurized butter, and organic. Olive oil for salad, not for cooking. For cooking, you can use avocado oil, grapeseed oil, heat resistance, right? And coconut oil. But lately, when I, study this advanced cardiovascular, they discourage us from using coconut oil for cooking, because once you open and not finished, then it can go rancid. Then you will get trans fat. So you also can use flaxseed oil, right? What about bad oil? Which one are bad? Okay, bad. Trans fatty acid, non-dairy creamer, corn oil, sticky, peanut oil, soy oil, canola oil, shortening, margarine. Those are bad. Don't use that. So dehydration. What about dehydration? When you eat, you have to drink, right? Do not drink while eating, because that will only delay your digestion. What about how much water you eat a day? So again, I think I mentioned it before, is the weight in pound divided by 2 is the amount of ounces of water per day. Let's say I'm 150 pounds, and then I have to drink divided by 2, so 75 ounces of water a day. Okay. Okay. There's a questions. Okay. Shopping tips. I'll do shopping tips in a separate video. How about that? Because there are so many, and we might not have enough time for that. So, how important is eating? We need to eat for hunger, but some people eat for comfort, thinking that when they are full and happy, they can sleep better. That's wrong. Some people eat because they are bored, and many other reasons. It's called emotional eater. They can gain weight easily and they can lose their weight easily, but it's not very healthy, right? So, diet has something to do with insulin factors, and bad diet can cause high blood pressure, syndrome X. I'll touch that in a different videos. Uh, Questions: is there a miracle foods? Well, miracle foods, whatever you call it, but plant-based diet can reverse heart disease, cancer. It has been documented scientifically, and lower the insulin resistance, because insulin resistant, high triglyceride, high lipid, and high blood pressure, and that is called diabetes type 3, and will lead you to Alzheimer's. You are what you eat. You always hear that, okay? So less varieties is less healthy. So you want to eat varieties and different every day, then it's good. This is connected with diet is dementia, coffee, atherosclerosis, Alzheimer's, cancer. It can also cause early puberty. Nowadays, you can see many of the girls, they have their period at 8 years old, 9 years old, versus compared to when I was growing up, we actually have puberty or period when we are 13, 14, or 15. That's because all the meat right now, the animals are being injected with hormones. And then that, if we eat them, of course, it will create a problem with our hormone. So that's the reason why we have a terminology like organic. Okay. And are we eating an ideal food? Well, in the whole world population is probably 7 billion. Almost 2 billion are overweight. Can you imagine? So the the population of 65 years old and older is 50%. And most of them, they are taking already drugs properly prescribed by their doctors, okay? 6 to 7 different kinds. And these drugs, prescription drugs, has a side effects. Now, this is properly prescribed, so to help them save from death, for example, right? But why? Why should we train our children to grow like that and then end up like that? We should know how to reverse hypertension, diabetes, and prevent cancer. Okay. Can we all eat the same diet? Well, don't we have the same DNA sequence? It's practically identical, your DNA and my DNA. We share almost the same and sure we'll need similar diet besides human milk when we were born, right? Some get it, some don't, but the rest should be similar. So basically, plant-based food diet is the best. Early stage of life or all life is covered. And you add vitamin B12 and vitamin D3. If you're vegetarian, you don't get this one from your diet. But now the animal-based diet is still the dominant. So, okay, just for a few minutes, do and don't, right? Don't overeat. Major cause of bacterial toxin to enter the blood and the lymph, causing liver to plug up and can produce gallstone. Irregular eating habit is not good. Just eat your regular meals the same time. Cut down alcohol if you can, because that is a burden to your liver. Rule of thumb of healthy aging diet: avoid rice. Just go brown or quinoa, but they all have high glycemic index. All rice. Quinoa is 35. Rice is 80. Pasta. Angel hair pasta is fine. Or just go gluten-free pasta. Now it's available. Dessert, low glycemic fruit is okay. Avoid all those refined sugar, cake, all those. Sweet drinks, sodas, and all those. Avoid acidic food, sweet acids like red meat, peanuts, except almonds, maybe it's alkaline. Or alkaline food is like ripe fruits, apple, pears, peaches, berries, coconut juice, all pH 7.2. Avoid pasteurized milk, cheeses, dairy products, okay? And use sugar alternative like stevia, raw honey, monk fruits, agave. Okay. So most linked to the sugar is linked to hormone called insulin. If you have insulin resistant, you really need to modify your lifestyle. Dinner time 6 to 7 o'clock max, because that's when the insulin is at the lowest level. So, if not, you have a problem, because you have a tendency to elevate your uric acid and leptin. Leptin is a fat hormone. If you're resistant in insulin and leptin, you cannot lose weight. And avoid abdominal obesity. How much to eat? 60%. How? How to eat 60% full? Let's say you eat a plate like this and you cut 40%. Then just eat 60% and slow, because it takes 20 minutes from the gut to your brain to tell the brain I'm full. So if you eat slow and you chew well, then it's healthier. What kind of testing for diet? Well, we do here epigenetic hair testing. You take the follicle and use a graph and send it to Germany. It comes back with 36 pages full of information. Or we use immunology testing, immunoglobulin G, for vegetables, spices. And then nutrition evaluation, we use blood and urine. Blood typing is good because there is a blood, eat for your blood type. Type A, type O, type B, AB, they're all different. Okay, type O is more protein, right? Type A is more vegetable because they are prone to have cancer, according to Dr. Diamo. Get the book or read or download it in your cell phone, and it's free. Dysbiosis is when the yeast, virus, bacteria in your gastrointestinal system is not balanced, and you can test that one. Thank you. Subscribe to my channel, and then you can type questions if you want, and click for the bell and notification. Share with your friends and loved ones. And there is a reminder button as well. And then this program live is every week Thursday. And to replace my monthly seminar in Pasadena office. Thank you for watching. Okay, let me see these questions. Okay, is cherry a good fruit? Yes, cherry is a good fruit and low glycemic index. And then how do we find if we have any broken gene for any nutritions? Well, I did my NAD, New Amsterdam genomic testing. That's when Andrew came and tell me that I have 5 broken genes. So that is one of the option. Okay, they can find broken gene. Many people have these broken genes. And then did you say eat your fruit before your meal? Yes, you eat your fruits so that you masticate here, and it's called digesting. Actually, European, they do that. They eat something before their real meal so that their gastric acid will come out. Okay, so the pH will go down, and so when you eat your meal, the meal will be digested better. Okay, one moment. Hi, Dr. Maria. Very good. Oh, thank you, Dr. Cynthia. Do you believe in the book, right? Eat for your blood type? Okay. I tell you what, I only have one religion, so I don't believe it, but I follow it. It's not a religion to believe, right? But I find that about 50 to 60% correct, especially for blood type O and blood type A. So you have, in fact, I will list the book what I read. This is, where is it? Oh, here. Right? Dr. Diamo. And then at the back is all these summaries. Now, I will list what kind of book. And if you want, if you're here, you're happy to borrow and return it later. All right, so um, please do a video on healthy weight loss. Yes, I will. What time of the day does one take leptina drops? Oh, in between meals. So empty stomach, you spray the leptina, okay, alcohol-free leptina, like 3 to 5 sprays to stimulate so that your leptin works again. Leptin is the fat hormone. If your leptin is resistant and you're insulin resistant, you cannot lose weight, no matter how hard you try. It's very difficult. Basically, you have to not eat. Okay, what else here? What time of the day does green tea affect the absorption of magnesium? Green tea is, I learned about green tea. Green tea is the only tea, if you get it right, if you get the real green tea, it doesn't have caffeine. So I can drink green tea actually, and I do occasionally, but I'm used to water. So I do not actually try to drink too much tea. I'm afraid tea that are available is not a good tea, and I'm just trying to raise my magnesium. I take a lot of magnesium. It's probably like 2,000 more milligram than normal people take it, because that's my broken gene. Thank you very much. My next video live next week, Thursday, will be on nutrition. Now that's very hard, isn't it? So, but I'll see you then. Thank you.